Given the unfolding situation relating to COVID-19 in New Zealand and globally, the IOD wanted to provide you with an update on ways boards can approach this public health situation. We know the risk and relevance for one company will not always be the same as it is for another. Different scenarios will play out depending on the sector itself, SMEs, not-for-profits, state sector, and private and listed companies. As directors, our response needs to stay focused on the unique business risk for our organisations. It's an evolving situation which brings uncertainty, but as we know, challenges build resilience. Today we will hear from Professor Michael Baker, Professor of Public Health and Director of the University of Otago's Health Environmental Infection Research Unit, and one of our experienced directors, Melissa Clark-Reynolds.
I've been in the business long enough to have seen, I guess, my third pandemic, if you like. So there was SARS, which fortunately in 2002-03 was actually relatively easy to contain. It wasn't so transmissible. And then in 2009, an influenza pandemic, which swept through and fortunately was not very severe. Now we have something that is somewhere between. It is more transmissible than SARS and less transmissible than influenza, but unfortunately it has a higher mortality risk than the last influenza pandemic. It's not 1918, but this is the biggest pandemic threat that anyone alive today has ever seen. The top 5 things I would suggest for any employer, number 1 is information and dialogue. Have the conversation with your staff right away. Make sure they're comfortable with their level of knowledge about the threat. Make it absolutely clear to them that you're on their side, and I guess we're all in it together and we're going to get through it together. I think that establishing that dialogue very early on now actually is very reasonable. I think the second thing is the most basic, is supporting hygiene behaviour. So that's making sure that there are really good hand washing facilities available. Soap and water is still the best and the cheapest. You can have hand sanitizer for some settings, because particularly in foyer areas and near lifts where people just feel that a bit more comfortable when they're touching things. A third area is the most critical, is case isolation. So if someone is at all unwell, they must feel empowered to stay at home, and there isn't a barrier to that. So that means they're feeling unwell, there may be a bit of tiredness, particularly if they have a cough that's vital, obviously a fever, they stay at home till they're feeling better. The fourth thing is what we call social distancing, and that is making it easy for people to, if the job allows it, to work from home. And you don't necessarily have to do that now, that we don't have community transmission, but what you do have to do now is kind of do a rehearsal for it. So have a day, say, look, everyone's going to work from home today, and we're going to see how it works. And that you want to iron out the glitches before we get community transmission, which we may not have. We may actually prevent it. The fifth thing is identifying your most vulnerable workers. And with this virus, the risk is much, much higher of a bad outcome if you're older, if you have a comorbidity, and these are quite common things like heart disease, respiratory disease, severe asthma, diabetes, and obviously anyone who's immune compromised. Identify those people now and make it clear that at any point where there's community transmission, you're going to support them going home, not coming to work, perhaps for quite a sustained period. So there's obviously a good question about whether this pandemic was predictable and whether we'll see it again. I think the simple answer is yes, we will. We often say they're a bit like earthquakes. We can work out the level of risk in different places, and obviously it's a bit higher in Wellington, but that still doesn't tell us when it will happen, exactly where it will happen, and how severe it will be. And pandemics are very similar. One of the things I think about this is we have to learn as much as we can about this event, and organisations that are the most resilient will be the ones that come out on top at the end of this. And that really does mean learning as much as you can from it, adapting, engaging with people as much as you can, and I guess also demonstrating the most responsible approaches. I mean, all of that will, I think, strengthen you and your organisations at the end of this, what will be quite a trying time?
There's a real opportunity here for directors to get our business continuity plans implemented. So we've had a number of events over the last few years. In my director career, for example, we've had the Christchurch earthquake, the Wellington earthquake, we've had the terror attacks in Christchurch, we've had M. bovis in the agriculture sector, and now we have this pandemic. These were all opportunities for us as directors to think about the continuity of our businesses. And there's a number of things we need to think about. What are our succession plans? How are we thinking about we run the company if the SLT and the board are incapacitated? How are we going to run the business if our staff can't come into work? How are we going to run the business if our supply chains are disrupted, which they certainly are in the primary sector at the moment? How are we going to run our businesses if our staff can't work from home because we have a process-based industry and they're required to come in order to run the business? These are all questions that apply whether it's an earthquake or whether it's an epidemic. And we have a massive opportunity now to implement those plans and to also have a think about how we might really make our businesses more resilient in the future. We know there will be another event of some sort. It may not be another epidemic, it might be another earthquake, it might be a war in our major supply chain locations. There's all kinds of things that will disrupt us. Now, as a director, I'm really interested in how we monitor what is going on for the company. And at the moment, I think that there are a number of reports that we need to be looking for. So clearly we need to be looking at sick leave data. We need to be looking at what is happening in our supply chains. We need to be thinking about whether we can divert product from a disrupted market to another. So a good example would be, the amount of product going into China. Those ports are starting to jam up, and we might be really needing some reporting on how we're diverting product into the US, say. So thinking about what is the right thing to be monitoring as a director is essential to us managing this situation. Another good one is thinking about how our staff are feeling, if they're feeling safe. It's a great time to be doing pulse checks and understanding how we're managing staff engagement. Are we looking after people? Because we've known from previous crises, including the global financial crisis, that the companies that really look after their people and look after their customers in situations when they're disrupted come through stronger than they were before. I think whenever any threat comes along, we tend to think of it as something we have to defend ourselves against. But I think a lot of directors should be thinking deeply about what the opportunities are here. So there's a lot of opportunities in terms of how we have our staff collaborate better, how would they collaborate better even with our customers through technology. But also we could be really thinking about how that business is going to survive no matter what. One of the questions I think directors really need to be asking is, if this pandemic lasts for 2 years, which many of the specialists are saying it will, what do we need in place in order to ensure that the company comes out the other end in good shape? That will mean thinking deeply about how we manage our cash in that time, how we manage our supply chains in that time, and how we develop new products. So 2 years is a long time without our revenue being as strong as it has in the past. But I think it's a very good time for directors to be asking these key questions.
There were many takeaways from today's discussion on COVID-19, including how to focus on business continuity and building resilience in times of uncertainty, how to monitor the disruption in supply chains, how to keep your staff, contractors, volunteers and clients informed through ongoing dialogue, the need to empower staff by offering alternatives to working from the office, providing opportunities to collaborate through technology and increasing your digital capability. Many organisations are doing a trial run of working at home for their staff. Now's the time to trial and smooth out the kinks. We hope you found this useful, irrespective of your sector. It is important to remember that people are the key to organisations' resilience, and we need to make sure we're doing everything we can to keep them safe.